This week on the BackTable Podcast.
I think if you start being open to things that may not be on your radar screen, things that might be out there. People ask me, how can I do what you did? And I said, well, what are you interested in? They're like, I just want to get into industry. That's not why I did it. I did it because I love this therapy. And I just felt like it was really the right thing because I could be cause in the matter of getting some of the innovation that we as physicians had wanted for so long to drive that research agenda to expand indication. So I think because I was passionate about it, so being true to yourself, having the right motivation, and doing it with integrity. So always being able to go back and say, am I proud of what I'm doing? Can I stand in front of you and give a talk and know that everything I'm saying we can back up with proof source?
Hello, everyone, and welcome to BackTable Uro, your source for all things urology. Today, I'm your host, Dr. Michelle Van Kuiken, hosting this special collaboration episode between the Society of Women in Urology and BackTable Uro. Today, we'll be discussing opportunities outside of academics, specifically related to industry. With me today, I'm delighted to welcome Dr. Karen Noblett. She is currently the Chief Medical Officer and Education Lead at Axonics, which is now part of Boston Scientific. She is not a urologist. She is a very esteemed urogynecologist, but her work with Axonics has led to tremendous advancements in sacral neuromodulation, for which we are all very appreciative. The company has also had the ability to acquire Bulkamid from Contura, which has been a true game changer in the female stress urinary incontinence space and has become a standard offering in my practice. So again, welcome, Dr. Noblett.
Thank you, Michelle. It's really a pleasure to be here. I appreciate the invitation. Just by background, as Michelle mentioned, I am not a urologist, but work very closely with the urology community for many, many years. And by training, I did all my training really at UC Irvine, so medical school, residency in OBGYN, and then fellowship training in urogynecology and reproductive pelvic surgery, or URPS. Had an opportunity when I finished my fellowship training in '98 to actually do a mini fellowship in electrodiagnostic medicine as it applies to the pelvic floor. That was back in Indianapolis with Tom Benson, who was a pioneer in sacral neuromodulation. So I got exposed to sacral neuromodulation at that point in time. And I came back and then spent most of my career in academic medicine at the University of California, Irvine, where I ran the fellowship program. I was division director and adopted sacral neuromodulation early on in my practice. So got trained in 1998 and my first implants in 1999. So really involved with the therapy pretty much from the inception since approval in the United States.
Well, awesome. So my first question for you is, I was hoping you could take us on your journey of how you went from clinical medicine to your current role in industry. And can you tell us a little bit more about what your current role is at Axonics?
Sure. Yeah. It's probably one of the most common questions that I get. I think especially having been in academic medicine really my entire career, it's a big shift, really to leave that practice and then, go into industry. And it certainly was not an easy decision for me. But I would say early on, I started working with industry, primarily, getting research support, teaching, education, and even being on, advisory boards to help drive innovation. And I really enjoyed that relationship with industry. Working with industry was not foreign to me, but in my practice, I got into other leadership roles at the university. So, I got onto the executive board and I was chief of staff. I served as the interim chief medical officer at UC Irvine. And in tandem, I had gotten into some other leadership roles with some organizations like AUGS, the American Board of OBGYN. And in those leadership roles, I started discovering the opportunity to have an impact really at a greater degree. So when I think about, if you think sort of at that ripple effect, and when you treat one patient at a time, that's an important impact on that patient's family. But the ripple effect of that is somewhat limited. And then as I got into some of these other leadership roles, and in teaching, you teach the residents, you teach the fellows, and they're the next generation that's going to go out and take care of the women out there. That ripple effect's a little bit bigger. And then as I started working, and I met the leadership team at Axonics in 2014, really shortly after the company had been established. And the opportunity, as I started working with the company and the leadership team and discovering the philosophy of Axonics, I was given the opportunity to join the company, and I saw this as an opportunity to have a really global effect. So perhaps I was, having a small effect treating patients, a little bit bigger effect, teaching, our next generation of physicians out there. But here, now I had the opportunity to maybe have an impact on hundreds of thousands of patients out there. And this is a therapy that I was so passionate about. And I thought, gosh, I've never even thought of that I would be in that position. And as I was thinking about, what's next in my career path, as I'd gotten into some of these other leadership roles, I started thinking about what's next. This opportunity came, and I did a lot of soul searching. It wasn't easy. My ego and, my identity was academic medicine. And when I did that soul searching and did a lot of meditation and was really honest with myself about what was going to make me happy, the decision was clear. And since that time, I really haven't looked back. It wasn't an easy decision, but when I made it, I was pretty certain it was the right one. And the things that I am responsible for at the company now are all the things I love doing as a fellowship director, which is all of the clinical research and the teaching. So, and I don't have the politics of the university, so sorry about that, but, you're in the UC system, so I think...
Yeah, it's a little different. And so in your current role as Chief Medical Officer, what are some of the biggest challenges that you faced in your position, especially as you transitioned from a clinician to kind of a leader in the industry?
And I would say one of the biggest challenges was understanding that, there were different customers that we were responsible for. So, we think about who our customers are now. There are students, our residents, our fellows, there are patients, it's the hospital. But now as you get into business, especially as we were a startup, one of the customers are the stakeholders. And that's something that, you don't really think about when you're in clinical practice, but it's really important if you're going to be a successful company. So, understanding that was sort of a different audience that we needed to make sure that we addressed and paid attention to. So some of the things that may have been of interest for me from an academic standpoint, and if you were to come to me and say, hey, let's do this study, I'd be like, oh, that's such a great study, may not align with what, the company goals are or what, the stakeholders would think would be an important investment. And so for me, that was probably one of the biggest challenges, was not to be able to pursue all the things that were academically interesting. And then, of course, just some of the compliance issues with, being able to provide some of the educational things that we would like to do. But for the most part, I've had a lot of freedom to develop the whole educational platform at Axonics to really guide the clinical research that we're doing and really have that support from leadership here to be able to have that autonomy. And that's been fantastic.
Well, great. That kind of leads me into my next question. For those who are interested in making the switch to industry, are there any additional skills that are necessary or helpful? For example, pursuing an MBA or a master's in health administration, taking any additional special courses. Is there anything that you did in particular to prepare for this role, or anything that you would advise of others?
It's a really good question. And I would say that in my current role, the answer would be no, that you don't really have to have an additional degree. One of my goals had been to get an MBA. And so when I joined Axonics, one of the things that I negotiated as part of my deal was to be able to do my MBA. And Axonics actually supported that. And so right when I started with Axonics, I started my MBA program at UC Irvine. It was an executive MBA. That was every other weekend. And if you were to ask me, am I using a lot of those skills in my current role, I would say not really a lot. But I think what it did was it gave me a language. And I almost liken it back to, medical school. And, you're learning all of these basics, how many times do we have to memorize the Krebs cycle? Now, do we use that in clinical practice? No, but it gives us a language, right? And sets that foundation. And mine was not a healthcare-based one, so I was the only physician. And it gave me the opportunity to meet a lot of people, and now I have a different perspective. And I can have a different conversation, I think, when I'm talking to institutional investors or other people who are starting or have a product or an idea or starting a business. I think it gave me that foundation. I really enjoyed being back in the classroom. The other training that I did was that I went up to UCLA and took a course on corporate governance and became a certified public director. So what that does is that allows you to understand what it means to serve on a board, say of a privately held company, of a public traded company. So I recently accepted 2 board positions, which is something that was a goal for me. And so I think having my MBA, again, that foundation and that training was helpful. I don't think it's necessary, but it was something, that was a goal for me. And I wasn't sure when I was in academic medicine how I was going to accomplish that just from a timing standpoint. But, my CEO was very good about allowing me to have that time to be able to, put into completing that program.
Awesome. And we touched a little bit on research, both in your prior role in academic medicine and your current role at Axonics. Can you touch a little bit on the importance of, industry in research and establishing those clinical partnerships to help accomplish, research goals?
Yeah, I think it's so important. And I would say that when I look back at my career, when I first started in practice at UC Irvine, I was the only urogynecologist. I didn't have NIH funding when I went in. I didn't have a lot of that training in my fellowship program. And so the first grant I got to start doing research was from industry. And in fact, it was from Boston Scientific. And that really set the tone for me starting my research career. So being able to have industry partners, especially when you have, a grant process where it's an investigator-initiated program and you just get that grant and you own the data, you're running the study. I think that those resources are really important, and industry is an important partner to be able to provide those opportunities, those resources, and they do have funding. I know that even, at Axonics, as a smaller company, we developed a grant process, so we were starting to fund investigator-initiated research projects. And now being part of Boston Scientific, that opportunity is even greater. And as you know, government funding, NIH funding is much, much more challenging to get. So having these industry partners, being able to offer these grant processes or even getting involved with the clinical trials themselves, I think is really an important, relationship to be able to have, whether you're in academics or in private practice or a large LUGPA group. These are nice resources to be able to share.
And how do you continue to stay engaged or up to date in the medical community now that you're working outside of clinical medicine? I kind of know the answer to this one because I've seen you around a lot, but
Yeah. One of the advantages is that I've been able to keep my academic appointment at UC Irvine. So I stay involved with the fellows as much as I can, doing the didactics. I continue to maintain my board certification. So that's an annual process for us in OBGYN. So it's, reading a certain number of articles. I still am a reviewer for, certain journals. So I keep up with that. And then I took some of my academic practice into Axonics. I do a monthly journal club for our clinical team. So I'll look for an article that is relevant. Maybe it's historic or a new article, something that has to do with sacral neuromodulation or just the epidemiology or now stress incontinence. And then I'll review that, provide a summary out to the team. So that keeps me sort of up to date with that. And then I, still attend all of the major meetings, the AUGs, the AUAs, SUFU. And so I feel like I, have the opportunity to really stay up to date, as well as an opportunity to now be exposed to things early in the pipeline with other companies. I get contacted quite often from some of the institutional investors that I've worked with in the past that supported Axonics that I've gotten to know, and they'll be looking at another product and they'll say, "Hey, Karen, would you mind taking a look at this? Can we jump on a call?" So I get, an opportunity to see some of the things that, be up and coming out there as well.
Yeah, that's really exciting. Good to get that.
Yeah, I certainly have to keep track of all the other competitive devices out there and their clinical data as well. So. I think just being, open-minded. This was not on my radar screen. So if we were having this discussion maybe 10 years ago and you said, do you see yourself in this position? I'd have to say, no. I like working with industry, but I have my blinders on. I'm academic medicine all the way. I'm going to start my career and end my career there. But I think if you start being open to things that may not be on your radar screen, things that might be out there, but then always just do that gut check with yourself just to make sure you're doing it for the right reasons. People ask me, how can I do what you did? And I said, well, what are you interested in? They're like, I just want to get into industry. That's not why I did it. I did it because I love this therapy. And I just felt like it was really the right thing because I could be cause in the matter of getting some of the innovation that we as physicians had wanted for so long to drive that research agenda to expand indication. So I think because I was passionate about it, so being true to yourself, having the right motivation, and doing it with integrity. So always being able to go back and say, am I proud of what I'm doing? Can I stand in front of you and give a talk and know that everything I'm saying we can back up with proof source? And I think, so being open is the first thing, making sure your motivation is correct, that you're following your moral compass, and don't be afraid to explore. I think one of the things that we as women oftentimes do is we have to have 99.9% of the training to feel comfortable to take a new position. So I go back to when I was asked by the CEO at UC Irvine, would I be willing to become the interim chief medical officer? I was like, no. That was my first response. I don't know how to be a chief medical officer. What's the qualifications? And I'm like, well, what are the qualifications? And, why not? I'd been, again, chief of staff, pretty active in that role. And so when I thought about it and I went to my chair and I, talked to people, I'm like, I should just try it. I think that I've got the motivation to do that. I want to, make a difference. And so it was one of the best decisions I made. It was so enlightening for me to be able to serve in that role. So don't feel like you have to have all the training. You can get that. And it's okay to take a chance. And if you decide, hey, that doesn't work for me, you can always go back or pivot. But I would just say, think outside your radar screen and just be open. And then look for mentors. I encourage anybody to call me and ask if they're interested in doing this, or if you find somebody that's gone in to become a chair at a department, or they've gone into administration at a hospital. Talk to those people. Ask them what, their path was, what their decision tree, and how they got on that journey and ended up where they're at.
Yeah, I really like that answer. As I was listening to you kind of give that explanation, I recently heard this really great quote by Nancy Pelosi where she says, know your power, know your why, and be ready. And I feel like you really summed up that, and that, there might be new opportunities that you may not feel like you're ready for, but, go for it. You likely are more than qualified for that position.
That's a great quote. I hadn't heard that from Nancy, so that's
great.
I
just listened to another podcast recently where Julia Louis-Dreyfus was interviewing her, and that quote really stuck out to me.
Oh, that's great.
In working with industry, how do you maintain, credibility and connection with clinicians while working in the medical device sector?
Yeah, that's so important. And I think one of the things that I pride myself on is just, what I talked about earlier. I wouldn't work for a company where I didn't feel like I could be completely honest, and that anything that we're saying and presenting, we back up with proof source. I feel like I established a lot of credibility in my career, especially in sacral neuromodulation and doing the research. And I think just being really, really honest. And, we as a company will never say anything to mislead a physician, or again, never present any data that we can't back up with proof source. And if we don't have that, then we'll readily admit that. And so I think it's just maintaining that integrity, that relationship, making sure that you're always honest and able to answer any questions. And then when you don't know the answer, to say, I don't know, and to be, fully able to admit when you're wrong, or you've made a mistake, or you've misspoke. Again, I just feel like I had that relationship, and I've just continued to have that going forward. And this company has allowed me to do that, because I just couldn't be here. I wouldn't be able to be talking with you today, if I didn't have that confidence.
Great. Thank you. Well, my next question is, in what ways has working in industry fulfilled you in ways that clinical medicine has not? But the second part of that question is, what opportunities has working in industry and working with Axonics afforded you that you may not have gotten in your traditional medicine position?
Yeah, I think the opportunities that have been presented that I wouldn't have had are really getting involved with these new startups and being asked to be a board member. So that is something that I don't think I would have had that opportunity had I stayed in academic medicine. I don't think I would have been identified as somebody that, would be appropriate as a board member. But the other opportunity that's been so fun that I didn't really have the opportunity when I was in clinical practice was to be involved in innovation. And that's been extremely rewarding for me, being a part of Axonics, because when I met the leadership team, they didn't have an already developed product and instead took a very customer-centric approach. And so from the very beginning, we got a physician advisory board together. These were physicians, high-volume implanters for sacral neuromodulation, and asked them, what were their unmet needs? What were their pain points? What did they like? What would they like to see in the next generation? And then we did that with patients as well. So patients that were using remote controls, patients who were using rechargeable devices like in spinal cord stimulation. And we interviewed them about what their pain points were, what their unmet needs. And all that information went into the product development. So I, from the very beginning, had the opportunity to have input in all of the product development that came out, and then continuing to be involved with the engineers, innovating with some of the new products that we have coming out, like the Foramen Finder and remote programming and some of the other things that are really, really exciting. So that was an opportunity that I hadn't foreseen and something super rewarding for me.
And then, again, you touched on this a little bit, but do you now have mentors or role models in your current role, or were there ones that served as mentors in your transition? How did you find them? And the next question to follow that is, do you mentor others now who are making similar changes?
Yeah, it's such a good question. Mentorship is so important. And I'll answer the latter part of your question first. And being a mentor is a very rewarding thing for me. And I'm always open to that. So if there's anybody that ever wanted to come to me and ask questions, and I do feel that I have certain people that come to me on a regular basis in varying degrees, and not always physicians, but sometimes, people here at the company. And I love providing that mentorship. I certainly did have role models and mentors that I utilized, and I gained some mentors through this process as well. Some of our board members that I got to know really well, and then use them as an opportunity to learn from their stories and, their, I think, sort of pearls of wisdom of what's worked for them and what hasn't, and potential hurdles. And but I would say what is interesting is that I did not have a lot of role models or mentors when I was making this transition to say, oh, you did this. What was it like, and what should I watch out for? I just took this leap of faith. But I had many of my colleagues that I consider mentors that I went to and talked to and said, what do you think about this? And because, of course, again, as I mentioned, my identity had been in academic medicine, and they're like, oh, you're the perfect person. You've worked with industry, you've done the research, you're well respected in the community. We think that you'd be the right person. And so finding mentors, I think it just kind of happens. I think when you put the energy out there about what you're doing and maybe a need that you have, I find that these people come into your life. Our former CFO, Dan Deeren, our former CEO, Ray Cohen, are both big mentors for me, but in really different ways that they've been able to provide me guidance. And I would not have had that opportunity had I not joined the company to meet people like that. So people outside of medicine, people in business, people that are on boards, I've gravitated towards as mentors to provide sort of guidance in different parts of my life. And I'm anybody that is listening to the podcast or, has any questions for me or wants advice, for being in academics and the transition, I am more than happy to answer questions, jump on a call at any time.
Yeah, that's really great to hear because, mentorship and promotion of women is such a huge part of the Society of Women in Urology and why we exist and what we're hoping to accomplish. So I'm sure somebody may take you up on that offer, myself included. I think even in our interactions together and through Axonics, I already feel like you've been a, great mentor and colleague, and really appreciate, you taking the time to talk with us today. Do you have any other sort of last advice or anything that we haven't touched on today that you feel like, anyone thinking about industry, making these transitions, any sort of last pieces of advice for the listeners?
Yeah, I think the tide's shifting a little bit against being so anti-industry. I think if people have an open mind that, industry serves multiple purposes and can be a really good partner for whatever comfort level you are, it should be the physicians like yourself, Michelle, that are driving and working with industry and driving what innovation is next, what research question do we need to answer next. It should be those that are really, dedicated to this patient population. And those are the people that we really choose to work with. And again, I would just say, whether you're going into a career in government or private practice or academics or maybe into industry, there are different paths. You don't have to, follow, a straight line. And so just be open to opportunities that are out there. And, if you have questions about that, find a mentor, find somebody that, can help guide you and give you some advice on that. And I just want to say that I love the Society of Women in Urology and their dedication to mentorship and sponsorship and leadership for women. It's been, such a great meeting for me to be able to attend. And as a urogynecologist, I couldn't attend. So now I had to leave my practice and join industry just so I could go to a SWIU meeting. But it really is, I just love the fact that you guys are so dedicated to that. I just want to thank you for that dedication to that mentorship, and especially for the younger physicians coming in.
Yeah, it's an amazing organization, and we've really seen it grow and expand over the last, several years with more resident and medical student involvement. So that pipeline just continues to expand and grow. And we have our upcoming meeting in just about 2 short weeks, and I look forward to seeing you there.
Yeah, I look forward to seeing you there as well. But thank you so much for inviting me. This has been such a pleasure, and happy again to answer any other questions as we go forward.
Yeah, thank you so much. You've been an outstanding first guest for our semi-inaugural SWIU BackTable Urology Podcast collaboration. So again, I really want to thank you for being here with us today, and I hope everyone enjoys.
Thanks, Michelle. It's really been an honor.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend.
If you have any questions or comments, DM us at _BackTable on Instagram, LinkedIn, or Twitter.
BackTable is hosted by Aditya Bagrodia
and Jose Silva.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter, Aaron Bowles,
Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Jamila Kennebrew.
Thanks again for listening, and see you next week.